Thank you. Thank you, Shashi. Thank you so much for having us. I have here a very special human being. He's the epitome of resilience and perseverance. He has a fierce passion for tackling type 2 diabetes. Dr. Daniel, welcome to Metabolic Health Conference. It's a real pleasure to have you.
Thank you so much for having me, and thanks for flying in from India to have this session. I'm told it's a kindness.
Yeah, absolutely. Yeah, it's the only session on screen, one screen.
Yes.
So, just as a brief introduction, Dr. Daniel Katambo is a highly skilled physician specializing in prevention and management of non-communicable diseases with a particular focus on reversal of type 2 diabetes and weight loss. So Daniel, let's just jump into it. What brought you to type 2 diabetes, and what is the driving force behind putting all these efforts into putting and helping people with remission?
Wow, this is usually a question that I get from many guys who have interviewed me before. And my passion for type 2 diabetes reversal and remission came way like maybe 7 years ago when I was working in Bermuda. I met another wonderful human being called, I always have to mention him, Dr. David Kavan. He had just written a book on reversing type 2 diabetes. Having worked in Bermuda, which is a small island to the east of New York, you can imagine how many people were living with obesity and type 2 diabetes. And therefore, being a physician, again, it was just about medications, go and do this, monitor your sugars and this. Then all of a sudden, I see a book that is written on reversing type 2 diabetes. And then Dr. David Kavan, to cut the whole story short, comes into our clinic and we start this. And it was amazing when the same person who I was writing insulin huge doses, writing medications, now I'm prescribing this medication and they're feeling much better. Yeah. They're energetic, they're sleeping better, they're losing weight, they're focusing more. That was my motivation. And up to today, I've never looked back.
That's amazing. I mean, to see the passion just glow on your face for doing that's amazing. There's not that many people around the world that are from the mainstream that are focusing so much on remission or reversal. There is a lot more of just prescribing medication and maintaining diabetes for most people.
Most definitely.
Excuse me, Harsh, can you put off one mic because I can hear Hiko? So maybe you can use one mic so that both of you can speak from the same.
Sure.
Put off the other mic. Put off the other mic. You use doctor's mic, put your mic.
Yeah. So, Dr. Daniel, what is your vision in terms of treating people with type 2 diabetes? And what do you hope to change about the perception of the disease in broad healthcare system? And the reason I ask this is because India, as a nation, has over 100 million diabetics that are reported, as we just spoke, and over 136 million pre-diabetic. Wow. And these are all, again, reported numbers, probably a lot more in rural areas.
Yeah. So my vision remains to be, I remember when I was working in Bermuda and I started seeing how patients were feeling much better, feeling more energetic. I remember during that practice, I said to my mentor then, Dr. David Kavan, I think I need to take this message to Africa. That was Kenya. And at that time, I knew the numbers are rolling out to be the prevalence of diabetes is really increasing at a higher rate. Right now, it's about 3.6%, the prevalence rate of diabetes. So my mission was, first of all, to provide an alternative to patients, making sure that every other healthcare profession gives equal opportunity to these patients so that it doesn't just become a prescription-driven sort of treatment.
Right.
Let that patient get an equal opportunity as to why they need to change their lifestyle even before we change into drugs. And that has remained my vision because the numbers are growing. Many people believe that when you have diabetes, that is the end.
Right.
And I believe that is not the end. We can actually put this into remission. So in the broader healthcare system, you know very well, living in a low-income country, how much is it to manage a complication from diabetes?
Yeah.
An injection for diabetes retinopathy is about 80,000. An injection, amputation, what is the cost of somebody losing a leg?
Right.
What is the cost of dialysis? So you can imagine if we could prevent or put diabetes into remission. Now you're not using medication, and now you're not getting as many complications as before. And therefore, the cost of management of type 2 diabetes will really significantly go down.
Absolutely. I completely agree with you, and I'm bored because most of the people do not even know that they have an alternative to this idea that type 2 diabetes is a lifelong affair. So, in your experience, what have been the biggest challenges, either one or two challenges, that you're facing right now as you're trying to expand your, your mindset and the practice that you have in terms of spreading this knowledge?
I think the biggest challenge I feel like being in Kenya, when this message comes out and somebody has a passion to drive it, to be honest, you feel a little bit lonely.
Yeah.
So I'm really happy when I see such conferences and I see people talking about it, people who believe in the same idea driving it. The other challenge is the beliefs, the myths that people have had for a very long time. Like, eating meat is not healthy. You need to eat one or two. You need to eat 3 to 4 meals or 5 meals in a day. And so breaking through the myths is not usually an easy affair because you have to sit longer with your patient as opposed to when I'm just coming and writing a prescription.
Yeah.
So the reach as an individual is actually limited. I don't want to call this the last one. I don't want to call it it's usually a challenge as opposed to a problem. But most of us, like healthcare professionals, were trained in a curriculum that believed that low fat is the way to go.
Yeah.
And therefore, changing this even among the healthcare workers can be a bit of a challenge, and it will take time. But anyway, we can navigate them. I think with such conferences, we are able to put out the message, and the more we become resilient in these messages, the better, and the far-reaching the message it will be.
Absolutely.
Yes.
One thing you mentioned about your curriculum and training, right?
Yeah.
How much time did you spend as part of your medical training learning about nutrition?
Oh, wow. Maybe half an hour at most or less. I remember very well when the topic for diabetes was introduced was the first thing that you need to do is lifestyle change. However, the next thing that you need to do is metformin, and we went into drugs and drugs and drugs and drugs after that. So we don't really, our curriculums, we need to propose a way of changing them. We need to really make sure that we need the perspective of remission and reversal, which is maybe 10 to 15 years old right now. And with that, now we can have more and more healthcare professionals coming out knowing about reversal and type 2 diabetes.
That's fair. I mean, that's completely, I agree. Yeah. Speaking with a lot of other medical doctors, there doesn't seem to be a focus on nutrition.
Yes.
Medical field just as an industry has focused a lot more on treatment.
Yes.
And the advent of chronic diseases is not, you don't treat it the same way.
Yes.
Right. So, I mean, when you think about the challenges from a nutrition perspective, it's not as easy either, because you are one of the very few doctors focusing on lifestyle and nutrition, and there is so much misinformation out there. You talked about the different myths.
Yes.
People look at a headline, read an article, and they're jumping to conclusions.
Yeah. The main media, as you're saying, somebody publishes a paper and then they say, I saw it on certain TV. I read it in a certain newspaper. But when you look at the authenticity of the research, mostly they tend to be more observational studies. When you now try to undo that, it will cost you a lot. You find like publishing papers, writing articles, in as much as you can get free articles out there, as long as it doesn't seem to generate, some amount of cash here and there, then you have a challenge to put through. But I think the more we are really living in a world of, I would say, social media, where we can use different channels. Like right now, we are just broadcasting this in YouTube, where people can access this information and let it be free. And with time, maybe in the next 3, 5, 7, 10 years, we see much better now. Articles now say diabetes is reversible, diabetes is can be put into remission, you can lose weight, and focus on more therapeutic ways of managing weight and diabetes.
No, absolutely, absolutely. And right before the conversation here, you talked about genetics. There's another myth out there that people believe that once someone in the family has it, as it relates to type 2 diabetes, that it's genetic, that if you have it, you will have it for the rest of your life. Can you help us break down that a little bit?
Well, there is a lot of literature written down that type 2 diabetes is a genetic, has a genetic, predisposition. But when I look further, I tend to think, in as much as that might be true, I think what might be underlying more is our lifestyles. We might blame, I was giving you an example where we have probably let's take an hypothetical situation where maybe my dad was diabetic and my mom was also diabetic, and maybe my uncles and my sisters were diabetic. But you see, the lifestyle that they lived was, in a Kenyan way to say it was more
Hello. I think there is some internet issue. We'll just wait for them to resume.
Yeah, we can continue.
Yes. So I was giving an hypothetical situation whereby you have a family. You come from a family that has diabetes, but when you look behind what they were doing, they were really active. Our ancestors were really active. They would go fetch firewood. They would go long days without eating. They would go long days without getting a meal to eat. But fast forward, the generation that has come in, now we are driving to work. We are using elevators to go to the offices. We have basically become very inactive, but we are still consuming the same foods that our ancestors used to consume. In fact, in larger quantities. You get. So when now I develop diabetes, I will say it is in the genetic. So I think for that person who is living in such an environment, if they changed the way of eating, if they change their lifestyle, maybe adopting a low-carb way of eating, then we see this generation now not getting diabetes. So I think lifestyle plays a major role in terms of diabetes progression, and especially type 2 diabetes progression.
No, thanks for the clarity. I think, as you mentioned, what's in the genetics is our way of living. And if we can understand that and adapt to the current environment, I think we can do a lot of justice to ourselves.
Definitely.
You touched upon low carb. Let's dive into that. What is it about the food, especially low carb, or when you think about diabetes as a disease? Where is the issue in terms of diet specifically?
Well, it's an interesting thing, because the way you want to look at it is what really causes diabetes, right? And it's just what we talk about carbohydrates, the consumption of carbohydrates or sugar, Sugar is the one that drives diabetes, where you develop overweight and then you become, obese, and then eventually you develop diabetes. But what is the underlying thing is the sugar level, consistent, pumping yourself with more and more sugar levels. That drives your insulin up, and if you get insulin resistance, and that is what now leads to type 2 diabetes. Now, therefore, if we know the cause, if we know what is driving this problem, it is the sugar. And now we have to look at the 3 components of our foods: the fats, the proteins, and the carbohydrates. What is really converted to sugar? It is the carbohydrates. So the consumption of high levels of carbohydrates may lead to, or is what leads to, diabetes. Therefore, if now we say high carbohydrate levels, so therefore if we say low carbohydrate level, will actually lead to less insulin resistance and hence resolution of the same symptoms or diabetes remission. So when we now talk about low levels of carbohydrates, we are actually now looking at reducing the amount of sugar that you are consuming. I don't know whether you want me to go into the deeper levels of...
No, go ahead.
If we now look at how we consume carbohydrates, we can group them into grammage. So if you consume anything less than 30 to 50 grams, as long as you're less than 30, that is what we call sort of like a ketogenic diet, which also needs monitoring so that you get into ketosis.
Yeah.
Anything between 50 and 130 is now what we refer to as low carbohydrate diet. Anything between 130 and 220, somewhere there, is moderate carbohydrate diet. And anything more than 230 to 50, that is a high carbohydrate diet. So that's how scientifically we break them. But for me, and for those guys listening so that they understand, any reduction in the amount of carbohydrates you consume will result significantly in your sugar levels coming down. So I don't really put these numbers in front of people, because you can imagine we are coming from an era of counting calories. Oh, go to the gym, burn how many calories, and then you will be fine. And then now here we come with the low carb, and then we say start burning carbohydrates. So for me, it's just giving you the information, and making sure that you really understand why we need to reduce the amount of carbohydrates that you're consuming.
Absolutely. No, that's a wonderful explanation, and I think there are a lot of people who are still of the mindset that carbohydrate is required to fuel energy.
I know.
And we were discussing this about even people running.
Yeah.
They want to take in carbs
Yes.
to fuel their runs.
Yes.
What do you have to say to those people?
I don't blame them. I don't even blame even the healthcare profession, because that's what we were told. I remember in my campus life, that's exactly what you were told. So it will take, again, this is a challenge. It will take some time before we change the curriculums and the teaching changes. We know many patients come to me and they tell me, but carbohydrates are the energy-giving foods. That is what we were told. That is what we were taught. And even me, it was a shocker in 2016 when I started now advising patients on lifestyle change and reading more details into the nutrition bit. And I realized, actually, 1 gram of healthy fat is 9 calories. So if I eat 1 gram of healthy fat, gives me 9 calories in terms of energy. And then I eat 1 gram of bread or something like a carbohydrate, it gives me 4 calories. On top of it, it is giving me sugar.
Yeah.
So when I eat 1 gram of fat, I get the energy that I need, but I don't get the sugar.
Yeah.
So it's that difference. It will take time for us to undo. But for sure, we need to change that mindset in terms of how much carbohydrates you can consume. It is low carbohydrate, healthy fat, healthy proteins.
I mean, that's amazing. That's amazing, because no, you're very right, because the idea is to eat dense foods.
Yes.
That are not just calorie dense, but nutrition dense.
Yes.
And that are also not leading to these insulin and glucose spikes at the end of the day.
Yeah.
The myths around just these foods as well, right? I mean, we know that fats are demonized in the media. Fats are demonized as it relates to heart disease, cholesterol, etc., etc. Yes. And on the protein side, they're demonized because apparently we are consuming so much that we are damaging our kidneys. What can you help just break it down?
I know, again, again boils down to what you are taught. We are taught saturated fat is bad, and proteins can, finish your kidneys, or protein is associated with cholesterol. Again, it is just boiling down to what you are taught. And I don't blame anyone. I keep saying this. I don't blame anyone for that information. But now with new clinical trials, we now know, in fact, saturated fats are good for your health. They're actually protective. But how many people know about those studies? How many people know about such like clinical trials? There are very few, including healthcare professionals. How many people, like you've said, meat? I see patients who say we only are allowed to eat 3 pieces of meat, and or they are told to remove the chicken skin and peel it out, or they are told to eat 1 egg in a week. It's a whole myth that is surrounding everything around, and I think it's just based on what was developed, the food pyramid, the food plate, the WHO plate that has been there, and it will take some time before all this just turns around and we give the right information.
Yeah,
and that's why these forums are really good, and I love them.
Yeah, no, I mean, there is so many myths out there, and people are holding on to it. I mean, for example, you touched upon egg, right?
Yes.
We've been hammered in since probably 1950s.
Yes.
That the cholesterol in the egg causes the higher cholesterol in the body. How do we even tackle that? Because it's such at a like brain level that it's been hammered in.
I know. It's been like that, and I think if I look back on where that myth came from, I dated back maybe a certain large media in the US published a paper and said those people who had eaten eggs for, 18 years were found to have cholesterol that was high. And that now led to people believing that eggs are bad. But clinical trials are actually showing that dietary cholesterol might have to minimum to no effect on cholesterol. So that means then eating your eggs might not be affecting your cholesterol, and we need to actually rethink our messaging. Yeah. So I think in terms of myths, we have a lot of them. In fact, Dr. David Kavan just released a book saying demystifying the myths on type 2 diabetes and reversing type 2 diabetes naturally. And it will take a while. Yeah. The media, the newspapers, the podcast, Google anything to do with diabetes and the right diet. Low fat, taxing fast. So it's somebody has to do it. Somebody has to start from somewhere, and these forums are really good.
Yeah. Going off of that, we know that the mainstream push is for drugs like Ozempic.
Yes.
It's a huge market. It's a booming market, and what's happening is it's not just for diabetes, but weight loss as well. Yes. Now they're advertising it on the weight loss side and people are okay to accept it even despite the fact that there is side effects. Yes. And we do not even know the long-term side effects. So how are we trying to tackle these things when mainstream is just pushing pills, and you as a doctor, you want to address the root cause of type 2 diabetes?
Well, I think we talked about this before the whole interview, and I told you how it is going to be extremely difficult. You need resilience, you need passion, you need a vision for you to penetrate such messaging. Because remember, when you're taking a drug like Ozempic, what are you doing? I'm giving you a product so that you lose weight. And in as much as that it will have the effect, I'm getting a reward.
Yeah.
All right, I will get, it is $1 billion industry. Yeah. Now, when you come to me, I'm advising you to change your lifestyle. What am I getting in return? Yeah. Absolutely zero. And therefore, you can imagine I'm competing with somebody who is generating billions as opposed to somebody who is generating zero into the market. Yeah. And therefore, we will be hit hard. Yeah. But we just need to be resilient. We need to work hard and have the vision and make sure that Goliath in the Bible was killed by who? David, a very small person. And I think we are going to get there.
That's a very beautiful way of saying it.
Yes.
What about your own practice? You've set up a clinic here, and we talked about the struggles you had because of COVID.
Yes.
How are you sort of advising your patients specifically, because this whole idea of nutrition is very personalized. When someone comes in, they're coming in with their unique set of
Yes.
circumstances and challenges. And what do you say to them?
I think for me, I having known this whole idea of people coming in with different perspective, different myths, I take time to give exactly the cause and why they are where they are. When you explain this information, you give this information to patients, let me tell you, they make the right choices. Tell them, today your sugar was 6, or you woke up with sugars of 6 or 7. What did you consume in the morning? I consumed probably a starch or an arrowroot or a sweet potato or whatever they consumed. Now, when they come to your clinic at around 11, their sugar is 11. You ask them, what really sparked your sugars from 6 to 11?
Yeah.
And then they are like, oh, maybe it is this. I tell them, it's exactly the meal that you consumed. And remember, you consumed that meal and you still took medications and your sugar is still high. So for me, it is just driving to you and giving you the logical sense as to why your sugar is high. And when I now tell you, do you know, if tomorrow you repeat the same meal, and then not the same meal, you consume less carbohydrates, you remove or completely, you can even try without the carbohydrate completely and eat maybe some eggs, eat some vegetables, eat avocados, and then check your sugars before and 2 hours after. And the magic happens. That's when now they realize, oh, this thing really works. So I think the messaging is very important. How you frame and take this information to someone. Don't just demystify what they believe. No, just take them slowly. Give them the perspective. Let them try it. And then they will come and say, all along, I didn't know. I didn't know that consuming this was actually raising my sugar. So let them realize it to give it back to you that actually they're doing much better with low carbohydrate diets.
Wow, yeah. And I think it's going to take a village.
Yes.
Not just battling who we have to battle, but also we are actually battling people's minds.
Yes.
At the end of the day, people keep saying that my grandfather used to eat this way, my grandmother used to eat this way. And you mentioned that obviously you're not putting in the amount of effort that they did.
Yes.
But how do you break it down culturally to say that if this is their staple food, how do you tell them that the staple food is quote unquote killing you?
Yeah, so again, it just goes back to the same messaging, because remember that staple foods, let's use rice. People from coastal region believe that rice, morning rice, in lunchtime rice in the evening. The thing is, just let them come. Now, let's say you are from coastal region. Okay, what did you consume in the morning? Rice. What did you consume in the afternoon? Rice. In the evening, rice. So this is what I want you to do. This rice could be raising your sugars. And in fact, that is why I came up with the book, the pictorial book. And that is helping patients realize this, because what is happening is when somebody comes and then they see that this cultural food that I've thought is the best is actually the one that is raising my sugar. And then they now know that they have an alternative, that what they were told that meat or healthy fats and healthy meat and vegetables that actually can control their sugar, they go like, wow.
Dr. Daniel, I mean, this was an amazing conversation. Thank you so much. You've talked about a lot of things, and I think people have a lot of things to think about as well, in terms of their cultural beliefs, in terms of them not trusting the mainstream just at face value, and really making decisions in a more deeper level.
Yes.
So I really appreciate your time, you coming here and having the opportunity to do this in person.
You're welcome.
Sashi,
thank you so much.
Back to you.
First of all, I want to thank Dr. Daniel Katambo for agreeing to come to India virtually and speaking. Truly, you have made this low carb across the globe. You have such a fantastic experience and knowledge. This half an hour does not justify at all. We are going to have one full session with Day Life in podcast. You can have 1 hour, 2 or 3, whatever you want. And you will be again hosted by Harsh again. So I want to thank you. Thank you very much, Harsh. You have made this session very interesting by personally flying down to Nairobi, Kenya, and hosting its very, very unique session. And we are so thankful. And it is Namaste from India. And I'll see you again. Thank you very much.